Stop everything you are doing right now, because what I am about to tell you in the next few minutes could literally save your life or the life of someone you love. There is a virus spreading across the United States and across parts of the world right now that most doctors are not talking about in their waiting rooms, that most news channels are barely covering, and that is quietly sending people, especially adults over the age of 60, into intensive care units with almost no warning at all. It is called the Hantavirus, and today I am going to tell you exactly what it is, how it gets into your body, what it does once it is inside you, and most importantly, what every single adult over 60 must do this week to protect themselves and their families. If you are new to this channel, I am a physician, researcher, and the author of work that has been cited in leading medical institutions across the country. I have spent decades studying how diseases affect the aging body differently from younger bodies, and what I am about to share with you today is urgent. According to data published by the Centers for Disease Control and Prevention, the case fatality rate of the most dangerous form of hantavirus, a condition called Hantavirus Pulmonary Syndrome, sits between 38 and 50%. That means nearly 1 in 2 people who develop the severe lung form of this disease do not survive it. And here is the part they are not telling you loudly enough. Adults over the age of 60, whose immune systems have naturally declined by up to 60% compared to a 30-year-old, are among the most vulnerable people on Earth to this virus right now. Before we dive in, I want to ask you something personal, and I genuinely want to hear from you because I read every single comment on this channel. Tell me in the comments section right now, how old are you, and have you recently been anywhere near a cabin, a storage shed, a barn, a garden, or any space that might have had mice or rodents? You might be surprised by what you discover when you really think about it. Drop your age and your answer below. I promise you, I will read it. Now, I am going to walk you through everything you need to know about hantavirus, from what it is, to how it spreads, to what it does to the human body step by step, to real reported cases of people who have been infected, to the most critical protective steps ranked from important all the way up to the single most powerful thing you can do right now. We are counting down from 5 to 1, and I need you to stay with me until the very end, because number 1 is the piece of information that could make the difference between life and death. And I will tell you right now, the number 1 item on this list is something almost no senior is doing, and the reason why is going to surprise you. Let us start at the very beginning. What exactly is hantavirus? Think of it this way. Imagine your body is a city, and your immune system is the police force protecting every street corner. Now imagine a criminal so small and so clever that it slips through a ventilation shaft your lungs bypasses every checkpoint and goes straight for the power station, which in this case is your cardiovascular system and your respiratory system. That criminal is the hantavirus. It is a single-stranded RNA virus, which simply means it carries its genetic instructions in a fragile but highly efficient ribbon of material that it uses to hijack your own cells and force them to make copies of itself. It belongs to a family of viruses called Bunявiridae, and it has been present on this planet for thousands of years, living quietly inside rodent populations. The deer mouse is the primary carrier in North America. The rodent itself almost never gets sick. It simply carries the virus in its saliva, its urine, and its droppings, and it sheds it into the environment constantly, silently, and with no visible warning signs whatsoever. There are actually multiple strains of hantavirus found around the world. In North America, the primary strain responsible for severe illness is called sin nombre virus, which ironically translates from Spanish as the virus with no name. It was first identified in 1993 during an outbreak in the Four Corners region of the American Southwest, where a cluster of young, previously healthy Navajo individuals died of a mysterious respiratory illness that baffled physicians. In South America, a strain called Andes virus has been responsible for outbreaks in Argentina, Chile, and Brazil, and it carries the terrifying distinction of being the only known hantavirus strain capable of spreading from person to person. In Asia and Europe, different strains cause a condition called hemorrhagic fever with renal syndrome, which attacks the kidneys rather than the lungs. All of these strains share one thing in common. They exploit exactly the kind of immune vulnerabilities that naturally accumulate in the aging body. Now let us talk about how this virus spreads, because this is where I need you to pay very close attention. The primary route of infection is inhalation. You breathe it in. When infected rodents urinate, defecate, or shed saliva in an enclosed space, a garage, an attic, a basement, a cabin that has been closed for the winter, a garden shed, even the inside of an old car, the virus particles attach themselves to tiny dust particles and become aerosolized. When you walk into that space, when you sweep up droppings without protection, when you move boxes that have been sitting undisturbed for months, you inhale those invisible particles. They travel down your airway and reach your lungs, and the infection begins. Research published in the journal Emerging Infectious Diseases has found that the virus can remain viable and infectious in the environment for several days, and in cool, dry, sheltered conditions, potentially even longer. Secondary routes of infection include direct contact touching rodent droppings or nesting materials, and then touching your face, eyes, or mouth. There is also evidence of transmission through rodent bites, though this is far less common. And as I mentioned, the Andes virus strain in South America has documented cases of human-to-human transmission through close contact with an infected individual, which is why researchers around the world are watching it with extreme concern. The scientific references for everything I am sharing today are linked in the description below this video, and I encourage you to read them. Here is something critically important that I need every adult over 60 to hear. After the age of 65, your mucociliary clearance, that is the system of tiny hair-like structures lining your airways that trap and sweep out foreign particles before they can reach your lungs, declines in efficiency by approximately 30 to 40%, according to research from Johns Hopkins University School of Medicine. This means that the very first line of defense your body has against inhaled pathogens like hantavirus is significantly weaker in your body than it was 30 years ago. What a 35-year-old might inhale and partially clear before it reaches the deep lung tissue, a 68-year-old is far more likely to have reached the alveoli. Those are the tiny air sacs deep in your lungs where gas exchange happens and where hantavirus does its most devastating damage. So what actually happens when hantavirus enters the body? This is where I want to walk you through the timeline, because understanding the progression is absolutely essential. The incubation period, that is the time between exposure and the appearance of symptoms, ranges from 1 to 8 weeks, with most people developing symptoms between 2 and 4 weeks after exposure. This long silent window is one of the most dangerous features of this virus, because you can feel completely fine and have no idea that a storm is building inside you. The illness begins in what physicians call the prodromal phase. Think of this phase like the sky darkening before a hurricane. For the first 3 to 5 days, the infected person experiences symptoms that feel almost exactly like the flu. Fever, fatigue, muscle aches, particularly in the large muscles of the thighs, hips, and back, headache, dizziness, and sometimes chills. Some patients report nausea and vomiting. At this stage, the vast majority of people, including many physicians who are not specifically looking for it, would not suspect hantavirus. They would assume influenza, COVID-19, or a common viral illness. This is the window during which the virus is quietly replicating inside the cells lining your blood vessels, called endothelial cells. As it multiplies, it begins to cause those cells to leak. And this is where everything changes. Within 4 to 10 days of the initial symptoms, the disease enters what is called the cardiopulmonary phase. This is the phase that sends people to the emergency room. As the blood vessels in the lungs become increasingly leaky, fluid begins flooding the air sacs. The lungs, which should be light and airy like a sponge, begin filling with fluid. The patient develops rapidly worsening shortness of breath, not a mild breathlessness, but a terrifying, gasping inability to get air. Oxygen levels in the blood plummet. Blood pressure drops. The heart, struggling to pump effectively without enough oxygen, begins to fail. This condition, Hantavirus Pulmonary Syndrome, can progress from the first sign of respiratory distress to complete respiratory failure in as little as 24 to 48 hours. Many patients require mechanical ventilation and intensive care unit admission within a single day of their breathing becoming compromised. This is why rapid recognition of the disease is so critical and why I am talking to you today before you or someone you love finds themselves in that situation. Patients who survive the cardiopulmonary phase and with intensive supportive care in a modern ICU, many do enter a diuretic phase, during which the excess fluid that has accumulated in the lungs begins to be expelled by the kidneys. Recovery can take weeks to months, and some survivors report persistent fatigue and reduced lung capacity for years afterward. There is currently no specific antiviral drug approved to treat hantavirus infection. Treatment is entirely supportive oxygen, mechanical ventilation, fluid management, and time. This is not a disease where a doctor can hand you a prescription and send you home. Prevention is everything. Now let me tell you about real people this has happened to, because I want you to understand that this is not a theoretical risk.